Welcome back. We're now going to hear from 4 experts who are going to give some opening remarks before we have a discussion, really about how we strengthen the human rights of those affected by climate change. So it's my pleasure to ask Professor Dr. Claudia Treidel-Hoffmann, who's Director of the Department of Environmental Medicine at the Medical Faculty in Augsburg, to talk to us about the consequences of climate change for human health and disease. Dr. Treidel-Hoffmann, the floor is yours.
So I'm delighted to speak about a very, very important subject, because climate change is impacting on human health, and this means that at least 3 articles of the human rights are violated. So Article 3 means that everyone has the right to live, and the climate change is impacting on our lives. And Article 29 means that we have the duties to community. So everyone is at the moment also violencing this, because we are at a stage where climate change is getting worse due to our actions. So let me explain you in 8 minutes how climate change is impacting on our health. So climate change is making us ill, and from head to toe. It's impacting on our brains, on our mind. So an example, people are with dementia getting worse during heat periods, for example. The cardiovascular system is affected. Infections, we have new infections, but also infections that are now in Europe, for example, like the West Nile virus, which normally, and I was taught that, and I was educated that this is a virus which is in the tropical regions. It's also affecting the skin and the lungs, and also the gastrointestinal tract. But let me go a little bit further. So we have direct effects where you immediately can lose your life by storms, by drought, by floods, by heat waves. But then we have also the indirect effects on our lives, which water quality, with air quality, important, land use change, and also ecological changes. And then we have these social dynamics, which are impacting also indirectly on our lives. And as I said, all organs of the body are affected by climate change. So let me give you some concrete examples concerning the cardiovascular system. And here you have to know that heat is the major threat on human health. We experienced this year really extreme heats in Canada, for example, and this led to extreme death also. And here I would like to introduce this homepage for you, where you can also follow indicators of human health by the European Union. And you can see here that in the summertime here in Europe, death increased in hospital, but also death reported by the fire brigades. So this means during heat periods, we have deaths. And in Germany, for example, we had in the year 2003, 6,000 deaths due to heat waves. And I think it's underestimated, because we are not counting these deaths as accurate as we are doing for COVID-19, for example. And we are also trying to get into detail what is really happening. And this is one example of our research here in Augsburg, where we looked how weather and temperature are impacting on strokes. And you can see that strokes are strongly and highly influenced, and we have a high incidence of strokes when the weather is warm and humid. This means we need also to understand this, and then also to take precautions for patients in risk, to identify the vulnerable people, and then make risk alerts to those patients. Then let me shortly mention infections, because this is really a major threat. We know that the environmental suitability to the transmission of disease like dengue, malaria, and cholera is increasing around the world. So things are changing, and we have also to adapt in this regard. Then skin also and the respiratory tract is affected by, first of all, we know that pollution impacts on the skin of our patients. We know that when children are living high traffic roads, these children have a higher probability to develop this disease, which is called atopic dermatitis. And as medical doctor, I can tell you, this child cannot sleep, and also the parents cannot sleep. This is a severe disease, and important is it's a risk factor for the development of allergic diseases. This means here by blocking or by reducing air pollution, we can save health and we can prevent health, but also we can mitigate climate change. This is a double win situation. Another extremely extreme threat for our human health is the fires, the wildfires, and it's estimated that it's around 350 million thousand persons per year that are dying by fire smoke, and this is increasing. And you see here the areas where people are affected. So we have to go deeper into this, and first of all, we have to mitigate those fires. Overall, we know that climate change is impacting on our health in a direct and indirect way, because those climate change and also pollution is impacting on our ecosystems, on pollen, on spores, but also directly on our health, as I showed you here with the atopic dermatitis. So for the pollen, for example, we know that due to climate change, we have more pollen. Pollen are flying the whole year. We have more spores, but we have also new pollen, like ambrosia, for example, which is spreading in Europe. And this means we have here the impact of the ecosystems, and by this on our health. And something else, what we see is, or what we also predict, is that this is getting worse. This is a future scenario concerning birch pollen in Bavaria. And you see here that birch pollen are increasing in the next years, and especially here in the worst case scenario of the IPCC. And you see also that in the worst case, pollen are declining at a certain stage. And I can tell you, at that point, when the pollen are decreasing, other plants are already dead. And this is nothing we would really like to see in the future. So also by this, we have huge impact on our health. This means we have to build climate resilience. This is the major task for our health systems. We have to adapt, but we have also to mitigate, because you have to know that the health sector itself is one of the major CO2 producers worldwide. This means that also we from the health sector, we have to help to mitigate climate change. For this, for the adaptation, we formed a climate resilience center in Augsburg. Why I mention this here is because we need interdisciplinary work to tackle these problems. And this Center of Climate Resilience here in Augsburg is highly interdisciplinary. I would strongly recommend for you to read the 2021 report on climate change and health, which is just launched. And you can see here what is at the moment the situation for health in Europe. The Lancet Countdown clearly states, and this is a policy brief for Germany, that we have to implement health protection plans to reduce health-related risk. We have also to reduce the carbon footprint in Germany and in the whole world in the health sector. Sorry for this. And we have to integrate climate change and health in the education. And I can tell you this morning at 8 o'clock, I had the first lecture on climate change for our students here in Augsburg. So we are starting, but it's not enough. So To summarize, I have to say that people in every region of the world are increasingly seeing their health affected by climate change. Thus, man-made climate change is violating human rights. So this means mankind is in mortal danger due to climate change. The current commitments are putting the world on track to 2.4 degrees of warming. This means the cost of inaction on climate change and health will vastly outweigh the cost of acting now. We have to act now in order to respect human rights. Thank you very much.
Thank you very, very much for that extremely worrying diagnosis of the impact of climate change on human health. And as you say, it's making us sick from head to toe. And I found that very interesting, that also that there's a large carbon footprint from the health sector.